A very, very good morning to you, Dr. Puja.
Good morning to you as well.
Dr. Puja, please talk to us about this month. It is touted as the Lung Cancer Awareness Month. What are the symptoms? How can people, look after themselves a little better?
Absolutely. So, as you know, November is Lung Cancer Awareness Month, and statistically, lung cancer is one of the most common worldwide cancers, and unfortunately, the leading cause of death. So, there are certain signs and symptoms you should watch out for. Unfortunately, when most patients present with early stage lung cancer, they tend to be asymptomatic. But when they start developing symptoms, they're usually subtle, more commonly cough, frequent respiratory infection that get masked as underlying cancer. People can have hemoptysis, so if you have blood in your cough, that's serious and you should be worked up. You can also have other signs and symptoms like shortness of breath and chest pain, fatigue, fever,
Right.
chill.
Doctor, as we speaking, I got a message saying, vaping, smoking, or any form of, taking in a substance like shisha, is that bad for your health?
Absolutely. You know it. Everybody knows it. Smoking is by far the leading cause of lung cancer. Now, to be very honest, actually, there's no causation that's directly proven with smoking, but there is a strong association. And such is the case with shisha, midwalk, and vaping. In fact, 1 hour of shisha is equivalent to 100 cigarettes. So if you smoked 1 hour of shisha, you've done 5 boxes of cigarettes. So it's extremely dangerous, and it's the contaminants, the carcinogens that reside in these agents like tar, formaldehyde, and benzene, which will damage your lungs and make you prone to lung cancer.
Right. So someone's saying that I quit smoking. I had been a chain smoker. I quit that and now I vape just to get over, my addiction of smoking. How would you rate this, doctor? Is this like a clean habit, or would you say that, fizzle this out as soon as possible and just go, become a cold turkey? Like that's what people say, right?
Absolutely. You're absolutely right. Vaping is not an alternative. People think that I will quit smoking and I'll do e-cigarettes and vaping, and maybe it's the habit that I need to get rid of. In fact, they can be even more dangerous because they cause other damage to your lung. Chronic inflammation is very bad for you. Just like chronic inflammation will cause COPD and emphysema, this is also damaging your lungs, which can then predispose you to other diseases. As for now, we don't have data to suggest that it's giving you lung cancer, but is just as dangerous, if not more.
Right. And someone asking us, how do we clean? Okay, since I've been a smoker, I'm sure that, like doctor just mentioned about the tar being inside the system. Is there a way that we can clean it?
No, once you've done the damage, it is not reversible. The longer you go out from smoking, the better the chances of the systems recovering, your lung and your heart recovering. But once the damage is done, you're already setting yourself up for cancer. So the best thing is not to start smoking ever.
And the ones that have already started, what would you tell them? How early
Seek
must you
counseling.
quit?
If you're a smoker, then time is of the essence. You need to act now. You need to go and get smoking cessation. There are smoking counseling cessation clinics where you can get some either pharmacotherapy or even just counseling to be able to quit. There are nicotine patches and agents that are bupropion, which is an antidepressant, but also helps you with the crave of nicotine, and so you can quit smoking early.
Right. Now, symptoms and stages of the disease. Could you talk to us a little bit about this, please?
Right. Like I said, symptoms, most patients tend to be symptomatic at first. So if you're developing symptoms, you're already too late. But better late than never. So you have to go get yourself checked out. Early stages, they come in stage 1 to 4. So stage 1 and 2 are very curable. In fact, it can be cured by surgery. And stage 3 and 4 advanced stages, some of them can be cured by surgery, but most patients are just committed to either chemotherapy or radiation or some advanced biological immunotherapies that are coming up.
So, do patients immediately get to know what exactly it is, or it is only after severe detection, or when you go to the doctor, then only can you get to know that it is lung cancer?
Very good question. Sometimes people think I'll just get a chest x-ray and I'll find out. Unfortunately, chest x-ray may show you some sort of haziness and that gets brushed off. More commonly like pneumonia or infection, so you may be treated with antibiotics. But if you get further worked up and you find out that there's a mass underneath, and that needs to be biopsied to be proven that it's lung cancer. Nobody will treat you without knowing that it's biopsy-proven lung cancer.
Now, are there any symptoms, doctor, that one must pay very close attention to?
Absolutely. Just the cough, unquestioned, unexplained weight loss, weakness, fatigue, you're just not feeling very well. Something seems off. You need to check out. We all know our bodies, right? So if there's something wrong with you, you go get yourself checked out, whether it's abdominal pain or pain in your leg or something doesn't seem right. You should double check what's going on. You should go seek some additional workup.
And what are the latest, stages that I know we're aware of the, stage 1 to 4, but what is the survival rate? I think that's the question.
So we are making progress. In the last 20 years, we have entered this era where the landscape of lung cancer and how we treat it has changed tremendously. We're entering an era of personalized medicine where we can look for target mutations in the patient's tumor and either targeted therapy or immunotherapy, which helps us enhance our immune system to fight the cancer, has demonstrated excellent, phenomenal response, even for stage 4 lung cancers. There used to be a day when we used to say, oh, you've been diagnosed with stage 4 lung cancer, so that patient may not survive more than 6 months. But if we look for these genetic mutations, some people are surviving even 3, 4, 5, 6 years. So as long as you have a good oncologist, a good surgeon, a good team that's backing for you, you'll have excellent outcomes.
Right. And any particular medications and treatments, or maybe has there been an improvement in the field of medicine for you?
Absolutely. For lung cancer, as of now, if you have certain criteria that you qualify for a screening exam, you must get a lung cancer screening low-dose CT scan. There are specific guidelines, even it's specific in DOH, where if you're a certain age and you have a certain smoking history and you've only quit within the last 15 years, you should go get checked out for low-dose CT scans. There's no vaccine per se, but it's in the works. There are researchers at the University of Oxford designing a vaccine to prevent lung cancer. It'll only be offered to high-risk patients, and as of now, those are yet to be defined.
So is it safe to say that if you are a smoker, then only you you may get a lung cancer, or this is just like a byproduct? Like if you are smoking, you're just aggravating it.
No, you have a very good point. Even passive smoking, secondhand smoking, so exposure to people who may be smoking in your family are at increased risk of developing lung cancers. And in fact, recently we've now learned that even non-smokers, unfortunately, get lung cancer, especially young females of Asian descent. They may have mutations that may predispose them to lung cancer.
Right now, doctor, is there any particular way, how do we protect ourselves from lung cancer?
Stay healthy, breathe healthy air, wear mask if you're working in an industry where you may be exposed to smokes. If you work as a chef or a construction worker or tearing buildings down, you may be exposed to smoke and pollution all day long. You have to protect yourself.
So when you're saying smoke, doctor, you're talking about, you just mentioned a chef that is cooking that smoke, or what kind of smoke are we talking about here?
We're talking about any pollution, even bakur, the perfume, the inhalation agents. These are all damaging to your lungs. If you work in a coal mine, that coal burning or the fumes, they will aggravate. Our lung lining is not designed to be aggravated, and any inflammation will make it go into a repair cycle, and that process in itself will predispose you to developing mutations, and the lung lining cells are multiplying at a very rapid pace.
Well, thank you so very much, doctor, for all your words of advice, and hoping that we can lead a healthy life. Thank you, Dr. Puja.
Thank you for having me.